Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 34 of the Better Health Guy blogcast series. Today's guest is Dr. Elena Frid, and the topic of the show is neurology and autoimmunity. Dr. Elena Frid is a board-certified neurologist and clinical neurophysiologist, widely regarded as an investigating diagnostician, advisor, and treatment strategist specializing in infection-induced autoimmune disorders. Pioneering the field of autoimmune neurology, she often sees patients with complex cases of Lyme disease and co-infections resulting in multiple neurological complaints. Using cutting-edge diagnostic tools and clinical expertise, she's able to differentiate between idiopathic versus organic causes of various neurological disorders. Dr. Frid attended a coveted BA/MD program at Robert Wood Johnson Medical School and went on to North Shore-LIJ healthcare systems, where she completed residency in neurology and fellowship in clinical neurophysiology. Her many areas of expertise are general neurology, headaches and migraines, autoimmune neurology, neuropsychiatric, and neurodegenerative disorders. Her knowledge has been sought by patients from all over the United States, as well as England, Germany, Spain, Australia, and Canada. She is one of the most experienced and unique Lyme doctors in the field due to her background in autoimmune neurology, with heavy focus on diagnostic methodology, clinical expertise in neurology and psychiatry, and treatment therapy encompassing Western and Eastern medicine. Dr. Frid is a member of the American Academy of Neurology, a voting member of the International Lyme and Associated Diseases Society, medical advisor to the Project Lyme organization, and a member of the Independent Physicians of New York. Upon request from families, Dr. Frid frequently collaborates on complex pediatric cases of Neuro Lyme disease with Dr. Charles Ray Jones, a world-leading pediatric Lyme disease specialist with over 40 years' experience in dealing with children with Lyme disease and other tick-borne illnesses. And now, my interview with Dr. Elena Frid. Hello, everyone. Neurology and autoimmunity are such key issues in Lyme disease, and I'm excited to learn today from Dr. Frid. She is a neurologist and autoimmune specialist that actually believes in Lyme disease. So thanks for being here today, Dr. Frid.
Oh, no problem. It's my pleasure. Thank you for touching on this important topic.
Absolutely. How did you get into the world of Lyme disease, and did you have any personal experience with the condition?
So, the world of Lyme disease was taught to me by my patients. I always talk about this, that very soon after graduating from my training program in neurology and fellowship in clinical neurophysiology, I opened a private practice in New York City. And very soon afterwards, I started getting these patients that I wasn't really taught about in my residency and fellowship training, who were presenting in very odd ways and really didn't have a specific neurologic diagnosis that they fit in, and really didn't fit into a psychiatric diagnosis either. So I started exploring what could be wrong with these patients and really listening to them. They started bringing articles and telling me about various organizations such as ILADS, and I attended a few of the conferences. And now I'm kind of doing this full time. I'm seeing patients with Lyme disease and really autoimmune encephalitis and autoimmune disorders that are triggered by various infectious processes.
Fantastic. Those of us in the Lyme community certainly appreciate doctors who listen, so thank you for doing that. That's certainly wonderful to hear. When people think of Lyme disease, we often think more of Lyme arthritis, but these days it seems that there's more neurological symptoms than really the arthritic symptoms that many people think about. So what are some of the neurological presentations or manifestations of Lyme disease that you most commonly see?
So I actually, when I talk about Lyme disease, I say that all Lyme is Neuro Lyme. because even at the onset of symptoms, early on in the disease process, very often patients will complain of fatigue, headaches. I mean, that's part of the kind of the description of the disorder. And what are those things? These are neurologic manifestations of an illness. The problem becomes is when, these symptoms don't go away or don't get cured with a straightforward treatment process. And I tell you that the manifestations of Lyme and associated co-infections in neurologic realm can be very complex and vast. So I do talk about the fact that it can lead to, for example, neurodegenerative conditions, what we think of as MS, Parkinson's disease, Alzheimer's, and various dementias, ALS type symptoms. So I see patients that are presenting that way. Neuropsychiatric symptoms, people who have problems with unrelenting depression or anxiety or mood disorders, thought disorders, that can be secondary to an underlying organic problem, and in this case, potentially infections-induced autoimmune encephalitis. And a lot of times, neurobehavioral issues, mimicking autistic type of presentations, attention problems like ADD and ADHD, learning disabilities, and of course various pain syndromes, different types of neuropathies, your classic cranial neuropathies such as Bell's palsy. That's something that's part of the definition, but there's other neuropathies that can be caused by Lyme and associated infections that are not discussed as often, but certainly can happen.
So when you're working up a patient for infections that are potentially impacting their neurology, what are some of the tests in the realm of Lyme and co-infections that you find the most beneficial?
So I use a number of labs. This is a very important topic if for anyone who is a clinician, and even for patients to know that I often use blood work and I often retest patients quite regularly. So what I see in my practice when people come in and they say, well, I've had symptoms for the last 2 years or 5 years or beyond, and they said, well, but I tested negative for Lyme disease 3 years ago. That, this is something that needs to be rechecked. And even if you tested positive and let's say you're doing well or you're doing poorly, I mean, these are tests that should be rechecked to guide us to see, we're talking about the Western blot, for example. Okay, even from a regular, mainstream laboratory. I always talk about how that can guide us. It's not a perfect test, but it's a test that we have. It's one of the only tests and most commercially available, so we can use it and see. First of all, testing should be an extension of your clinical exam finding and your history taking. That's one thing. Secondly, knowing that the tests are unreliable, we need to consider that the interpretation of that test should be used based on looking at how the patient is presenting. So if a person, for example, had 2 IgG bands for Lyme disease 6 months ago, and you treated them and they didn't feel better, and then you recheck them again, and now they have 4 IgG bands for Lyme disease, but they're still not doing well clinically, they haven't met the CDC criteria, but they may have met your diagnostic criteria, and based on that Western blot that continues to expand with the bands, tells you that the patient is likely still suffering from that infection, right? So you have to use your clinical judgment. However, I do use other testing. I use specialty testing, specifically IGeneX and Galaxy. I also use blood work for looking for various anti-neuronal antibodies, essentially looking at your body's immune response to see if you're creating any anti-neuronal antibodies against your nervous system, and that I use through, again, regular labs that get sent to Mayo Clinic, as well as occasionally Moleculara for some patients, which is helpful for a specific autoimmune encephalitis that's used in children. And then, of course, I use mainstream tools in neurology like MRI.
So you focus on autoimmune neurology, which is a misguided or misdirected immune response, and then the resulting inflammation in the nervous system that can be triggered by underlying infections. So what are some of the common infections that cause this abnormal autoimmune response that then impacts the central nervous system or peripheral nervous system?
Well, actually, a lot of infections can do that. And in autoimmune neurology and mainstream neurology, it's very well understood that a lot of these processes can occur as a post-infectious process from even vaccines, from common illnesses, from common colds or gastrointestinal issues. So it's not any specific infection that may trigger that. It's any one of them can. And there's also a belief that 90% of our DNA is made out of basically viruses and bacteria that has been here for millions of years before we have. So there's some scientists who believe that if we get exposed to an infection that makes a significant portion of our DNA, that can trigger a kind of molecular mimicry and an autoimmune phenomenon. Specific infection or virus or bacteria, it's any one of them can do that, and it really depends on your genetic makeup.
That makes a lot of sense. So is autoimmunity always triggered by an infection or possibly a toxin, or are there cases where autoimmunity presents and there is not a specific trigger? And then once you remove the trigger, does the autoimmune presentation or condition itself resolve?
So in the world of autoimmune neurology, actually the first thing that we discussed how autoimmune, let's say, encephalitis presents as, and that's from cancer. Actually, cancers and even benign tumors were discovered. For example, teratomas, which are benign tumors of the ovaries, were discussed in women in Japan. That they were becoming essentially encephalopathic and were needed to be hospitalized and had breathing tubes and couldn't think or talk or do anything for themselves. Were very sick patients. And then when these tumors were removed, patients, were cured. So the answer to your question is it can be caused by other conditions other than infections. And there are situations when we say they're idiopathic, meaning we don't know what triggered that autoimmune phenomenon. And really the way to treat this process is ideally to identify what may have triggered it and treat the underlying cause. And sometimes what we need to do is modulate the immune system to kind of straighten it out, if you want to use a term like that, so that it stops trying to attack your own body.
So we talked a little bit about anti-neuronal antibody testing. You mentioned the Cunningham panel from Molecularis. Those are some of the tests that look at autoimmunity. Are there other key tests that you find helpful in the realm of autoimmune exploration? And then do those labs, like an ANA or thyroid autoantibodies, do those things generally resolve in your patients as they get further down their treatment path?
Right. So like you mentioned, the autoimmune markers are also ANA and ESR, C-reactive protein, thyroperoxidase, thyroglobulin antibodies. So there's many, right, that can cause issues, as well as various markers for different types of neuropathies. And then you do use other testing. For example, if you suspect that there's an encephalopathy issue, then you want to get an MRI of the head. You may want to order a SPECT scan or a PET of the brain. You may want to do a lumbar puncture or an EEG or a nerve conduction test. It really depends on the clinical presentation. And to answer your question, that yes, the anti-neuronal antibodies do calm down or subside with treatment and with kind of quieting down the immune phenomenon.
That's fantastic. So you mentioned that in Lyme, all cases of chronic Lyme or neurological Lyme, would you say that all cases of chronic Lyme also have some degree of autoimmunity involved?
I do believe that patients who have chronic symptoms or persistent symptoms of Lyme and co-infections, that it's really more than just a simple infection. I think it's a combination of a collection of infections, unrelenting inflammation, and an autoimmune response. So that's really why these patients have trouble getting better, because in order to get rid of this or to cure this, you need to identify everything that's going on with the patient and treat it all at the same time. And very often we just hone in on one aspect of what's going on, and we are not aware of or not treating the other conditions.
So Hashimoto's is an autoimmune condition of the thyroid that many people with Lyme also experience. I've heard things like Epstein-Barr virus, heavy metals, fluoride, lots of different things, Borrelia, that potentially impact those dealing with Hashimoto's. So what do you think are the key issues in Hashimoto's, and then do you see that resolve with treatment?
I actually have seen patients whose thyroid functions do improve, and actually that's part of the thyroperoxidase and thyroglobulin antibodies that we talk about. And certainly this condition can also lead to autoimmune encephalitis. So I think it is a combination where, you know, in that case, a person is predisposed to more than one autoimmune phenomenon, and we see that. You know, we see that in families, we see that in a specific patient that they may have. Scott,
yes.
You're here?
Yep.
Okay, because you froze for a second.
Yeah, I think you're on the wireless connection there as well, which is kind of going in and out a little bit, but it's okay.
It's okay. All right. Yeah, so I agree that it can, so one person may have more than one autoimmune phenomenon. And again, going back to the point that we made before, you know, treating the underlying process does improve the underlying issue.
Fantastic. So you mentioned sometimes we need to calm or modulate the immune system when it's overactive or in this autoimmune mode. I'm curious if you use tools like low-dose naltrexone or Plaquenil, or what are the things that you find most beneficial for patients to bring the immune system back into some state of balance?
So if a person is treated for their infectious etiology and within, let's say, 6 months, there's no significant change in their disease process, I think formally looking for an autoimmune phenomenon that has awakened is appropriate. And that includes looking for various types of neuropathies, like you mentioned, thyroid issues, looking for autoimmune encephalitis, I guess, depending on what the complaint is. And at that point, if the patient is testing positive and looks like the autoimmune process is there, I, in my practice, often use IVIG treatment at immune modulating doses. And then occasionally I recommend to some patients plasmapheresis in addition to IVIG. And I guess it depends on kind of where we stand. Sometimes there's also a role for hyperbaric oxygen treatment, but not everyone is appropriate for that. And kind of, you know, basically the point is that it's geared, it's patient dependent. There's no one formula that works for everybody. You really have to, like we talked about, recheck their blood work, re-examine the patient, and see why they may not be getting better, and kind of gear your treatment that way.
I know in some other autoimmune conditions, practitioners may use biologic medications like Humira and Enbrel and things like that. Are there potential risks of using those types of medications in someone who has chronic infections like Lyme disease?
I personally do not use these medications in my practice because if this is an infections-induced process that we're addressing, then lowering the immune system is really not the right way to go. Modulating the immune system is what should be done.
That makes total sense. You mentioned vaccinations. Do you think that vaccinations also are potential triggers of some of the autoimmune conditions that you see?
So it's a known fact that vaccinations can trigger various autoimmune phenomena in neurology. Let's say Guillain-Barré, for example. So that's quite well known in mainstream neurology. In terms of vaccinations in the patients that I specifically see with infections, even basically mainstream medicine recommends not to vaccinate people that we think are immunosuppressed. So again, just vaccinating people across the board because it's the flu season and now it's time to vaccinate, I don't offer that or recommend that to my patients. If I find that their immune system is strong enough and the kind of the benefit outweighs the risk, they may be appropriate to get a vaccination. But very often they may need to hold off because they're not feeling well, and vaccinations can exacerbate some of their underlying treatment because it's another insult to their immune system that's already struggling.
So I want to talk a little bit about some of the conditions that you see in your practice. You work with a variety of neurological conditions, and I'd love to hear what you think about each of these. What are some of the unique underlying causes, and then how you maybe approach treatment? So what do you think of chronic fatigue syndrome and fibromyalgia?
I think chronic fatigue syndrome and fibromyalgia are symptoms of an underlying disease process. And if patients are given the diagnosis, then we need to really explore what is causing these diseases. I don't think that it's an idiopathic process. It may be something that we just haven't discovered yet. In my opinion, it can certainly be secondary to underlying infections. It's a very strong possibility. Am I saying that every single person in this country, there's 5 million people who have a diagnosis of fibromyalgia, do all of them have Lyme disease? I don't have an answer to that, but I certainly think that a significant portion of them may have it, and so it needs to be explored. And if it is not Lyme, then you have to look for what else it may be.
How about conditions like multiple sclerosis and Parkinson's disease?
I think that these conditions can certainly be triggered by an underlying infection, and that is not big news. I think in the world of MS, they are exploring the possibility that it could be an infections-induced process. I don't know of any studies saying that they're looking into the possibility of Lyme. They certainly have looked into the possibility of Epstein-Barr virus, and I don't think that panned out, but they did look into viruses and infections triggering these immune phenomena. My question, and this is a question, I guess, to the world or to researchers, and hopefully to funding that can be done to look more into Lyme and what it can do, is I am not sure whether these conditions are triggered by Lyme disease and therefore have become an entity of their own, or in some patients, or if you treat the underlying Lyme, you can cure people from Parkinson's or, let's say, bad MS. So that's something that I am exploring and thinking about on a daily basis, and that's something that should be studied, in my opinion.
One of the conditions that I think frightens people the most, especially people that have neurological Lyme, is the idea that maybe their condition progresses to an ALS-like presentation. I'm interested in your thoughts on ALS. Are we getting closer to having treatments that actually can reverse conditions like ALS?
I think that there's a lot of interest because of, the Ice Bucket Challenge, which was very popular last summer, and there's a lot of noise being made for ALS, rightfully so. It's a very debilitating condition. There's a lot of work being done with stem cells, and I don't know, I guess in my practice, the patients who have been in the studies I have a couple of patients, they have not specifically done very well. I know that there's some institutions that are reporting some success stories. I'm not sure how close we are to reversing the ALS situation once someone has progressed, far enough where they're in a wheelchair and extremely debilitated. I have also seen patients with, like you mentioned, ALS type presentations who also on blood work met criteria for Lyme and co-infections. So again, I think it's, at least in my opinion, too early to say. I've certainly heard people say that they have improved and got their life back by treating infections when they received an ALS diagnosis, but there also have been patients who have not. So there's a lot of work to be done.
Thanks for that. So you mentioned earlier the Moleculara test, which I think you were referring to the Cunningham panel. So it sounds like you also work with PANDAS and PANS, which for those listening are autoimmune conditions. PANDAS generally triggered by strep, and PANS being kind of a broader category that may be triggered by other things, some infections like Lyme, but also other environmental exposures, possibly mold, things of that nature. So I'm interested in your thoughts around, in your patients that have PANDAS or PANS, what do you see as the primary triggers? And then with treatment, does the condition generally resolve, or is it something that a person needs long-term management over a period of time?
So some of the patients that I see whose symptoms have not resolved by just treating strep or having 1 or 2 doses of IVIG, I also see that when I test them, they become positive or test positive for other co-infections. Co-infections of Lyme disease like Bartonella or Babesia, or even Lyme itself, and sometimes various viruses reactivation. So it seems like the patients who don't get better with mainstream treatment and understanding of this disease also have other infections going on that need to be treated and addressed. And yes, if you do treat and address patients until their symptoms resolve, you can get rid of the kind of the encephalopathy that they present with the OCD behavior, tics, concentration problems, memory issues, regressive behavior does subside.
So the Cunningham panel, I've also seen that run in adults with Lyme disease, with mold exposures and so on, and I've seen positive indicators in the Cunningham panel. Does that to you mean that those people may have PANDAS or strep-related issues, or do you also see abnormalities in the Cunningham panel with people, let's say, that have water damage building or environmental illness from mold exposures or even Lyme disease? How does that affect the Cunningham panel?
So to me, PANS and PANDAS, the way I interpret it and look at it, is that it's a subset of autoimmune encephalitis, which is autoimmune encephalitis is inflammation of the brain, and it's an autoimmune phenomenon, right? So Cunningham panel tests for antineuronal antibodies. So the way I interpret it is that a person is creating antibodies against their own brain, and based on their clinical presentation, clearly they have a break in the blood-brain barrier, and these antineuronal antibodies are affecting them clinically. So I don't necessarily look at it as just a condition that's caused by strep or a specific illness. That's how I use it in my practice.
Perfect. Let's talk a little bit about dementia and Alzheimer's. Your brain obviously is working very, very well, but what do we do to keep our brains working well as we age and to minimize the chances of dementia or Alzheimer's as we get older?
This is something that I want to make a very clear point about. Memory issues at any age are pathologic. So it's never normal to not have good memory. It doesn't matter if you're 18 years old or 81 years old, it's not a normal aging process. Okay, and there are various reasons why people would have a decline in memory. One of those reasons, obviously, is insults to the nervous system, which means, either stroke-related issues or blood flow-related issues. And of course, dementias are buildup of plaque. And now people talk about how some of this plaque can be secondary to infections. Work of Dr. Alan McDonald, who dissected 10 brains from Harvard and noted that all 10 of them contained genetic material from Lyme bacteria and other infections. So I certainly think that something pathologic is going on with people's brains when they have memory issues. And I, worst of all, don't like to hear that from people who are in their 30s and 40s, who often come to my office and say, well, I just have a little memory issues, but I think I'm getting old. So that's not normal. In terms of how do you keep yourself healthy, that's actually an excellent point. As you said, I am on social media, and I often talk about the fact that we need to think about our health when we're healthy. So it's all those things. I mean, eating right and having some physical activity and kind of getting rid of the bad habits, of smoking and excess alcohol use. And, if you're on multitude of medications and are not feeling well, I mean, you need to change your life if that's going on. But anything specific is obviously using your brain.
All right, so let's talk a little bit about the nervous system. So one of the challenges in people that have a chronic illness is that we're usually in this fight or flight kind of mode, very sympathetic dominant. That is difficult to heal in that state. So are there any recommendations you give your patients to kind of move the body into more of a parasympathetic healing state?
Well, I guess we're talking a little bit about meditation and being able to control yourself in terms of quieting yourself down. I think it's healthy to do for anybody. I find it very difficult for Lyme patients to do that deliberately because a lot of times, as you mentioned, that system is out of their control and is actually working pathologically because they do have a lot of autonomic nervous system dysfunction. I do find actually that it does get better with treatment. So with proper treatment, their autonomic nervous system comes down, and we actually often take people off their POTS medication, medication to support their blood pressure and their heart rate. It's one of the first things that I would say comes off for people. So there is hope, and it is possible to do it with treating the underlying disease process. If you are, of course, able to control your breathing and meditation and do some yoga, I think that's healthy for everyone because we do live in 2017 stressful lifestyle where we need to multitask and be able to handle 100 things at the same time.
Absolutely.
But that's my advice, yeah.
Let's talk a little bit about the vagus nerve. There's a lot of interest in the vagus nerve and how important that is in improving overall health. Are there certain tools that things can use to stimulate or improve the vagus nerve, and then how might that be helpful in recovering from something like chronic Lyme?
Again, I mean, I think this is a very important point that you bring up, and I know that it's been out there in social media because people who are very vocal about Lyme disease are very vocal about their treatment, and this is partially what becomes very complicated in terms of treating Lyme patients, and even what's so complicated for Lyme patients themselves is that they don't have good guidance. So specifically, when you explore any kind of new type of treatment, I'm all for that. If it's done in a safe way by a person who knows what they're doing, and if you realize what are you doing it for. So vagus nerve stimulation would not get rid of the Lyme infection. right? So if you have any specific symptoms of, like we just talked about, autonomic nervous system dysfunction, and you feel faint all the time, and you feel like you get butterflies and your blood is not perfusing right, or your autonomic nervous system issues, then that's an appropriate treatment protocol for you. However, if your symptoms are pain symptoms in your foot, and you can't sleep right, and you have headaches all the time, that may not be the right treatment protocol for you. So you need to realize what is the treatment and what are you treating with that treatment.
That makes a lot of sense.
And I think that gets lost when people do alternative medicine and when people do different treatment protocols because it works for someone else.
Do you find that the nervous system is impacted by environmental exposures to electromagnetic fields, for example? Do you ever ask your patients to minimize their exposures to Wi-Fi and other things, and does that help the nervous system heal, or have you not found that to be a significant issue?
I have talked to other physicians who use that a lot. I think that there is a role for that. And I think that people do feel better just like with having proper diet. I just don't think by just doing that, it can cure people. Mm-hmm. I think it can minimize symptoms and can make people feel better. But if they're basically, coming to a point where they're seeing multiple physicians and multiple specialists just by eating the right food or having the right sleep hygiene or minimizing Wi-Fi exposure and electromagnetic fields, may make them feel a little better but won't cure things.
If people have damage to their nervous system, potentially to their nerves with things like myelin and so on, after years of dealing with chronic infections and viruses and heavy metals, how do we go about healing the nerves? And are there specific things that will promote healing of the nervous system and the nerves?
Mm-hmm. So the nerves, a lot of times if you have an insult to your nervous system for a prolonged period of time, right, so these infections can, quote unquote, pick at your nervous system, so pick at your nerves. And so often by getting rid of the infections, your nerves, especially myelin, you can remyelinate, so it can heal itself. Some of the things I talked about before, for example, IVIG would help with healing of the nerves and remyelinating. That's one of the indications that you do use IVIG for if you have demyelinating neuropathy. So that helps to support and, quote unquote, modulate the immune system.
Very good. Let's talk a little bit about inflammation. You've mentioned that a few times, and we know that so many of the symptoms that we deal with are the result of inflammation from a misguided immune response. So what are some of the tools that you use to reduce inflammation while you're working on addressing the underlying causes as well?
So one of the things I think we indirectly talked about is obviously diet. I usually don't restrict people to any specific type of diet, but I do think that there's a role, and I do think that some of the food that we consume does contribute to inflammation. There's also a phenomenon called mast cell activation syndrome, where some patients get very heightened inflammatory response and allergic response that has awoken because of underlying infection, and that needs to be addressed and tested for. Often can be done through diet or even medications to kind of quiet down the allergic reaction. I certainly also think that sleep is very important, but it is unfortunately very tough for a lot of patients with Lyme disease. I mean, things that you talked about, kind of leading a healthier lifestyle, trying to be active, which would help with the inflammation as well, doing certain detox things like, but I think that also should be done appropriately and with a physician who knows what they're doing. For example, glutathione, using infrared saunas, the hot water baths with Epsom salt and lemon water, but all of that needs to be kind of managed and monitored and advised for patients, because some patients are very sensitive and have a lot of trouble tolerating even these kind of anti-inflammatory treatments.
Absolutely. So I was looking at your website, and you mentioned the NeuroQuant, which is one of the tests that Dr. Richie Shoemaker also talks about. And so that leads me to the question, how often are inflammation and neurological symptoms related to environmental mold exposures in your experience?
Honestly, that's not something that I see in my practice very much. Again, you see what you look for.
Mm-hmm. Okay. Yep. Very good.
I do have some patients who follow the Schumacher protocol and do well, and then some patients who follow the protocol and don't do well because there is an underlying infectious etiology, and so then if the infection is not cleared, then the mold and all the other environmental exposures really, it's very tough to clear that. So actually, I want to touch on this point in detail. I think that in patients who do have these underlying Lyme infections and not just mold exposures, that is the driving force of their problems. So if you just treat the mold, these patients are not going to be back to 100% normal. They may have some improvement, but if you don't get rid of the infection, you'll continue to have underlying issues. So I think treating just the environmental exposures in patients who have both environmental problems and Lyme is inappropriate. You need to address both those things.
Very good. That's very, very good. I agree. Both are important, and people that explore both, I think, have the best outcomes. One of the things that people talk about a lot is their brain, that they have brain fog, memory issues. We talked a little about that, problems with cognitive functioning, and there's a great fear that their brain isn't going to come back. And so I'm wondering if you can just comment a little bit, as people get treated for Lyme and co-infections and other things that you're working on, minimizing the autoimmune presentation, minimizing inflammation, do you generally see that those issues improve?
Yes, so this is one of the questions that I ask all my patients. Do you have any good days? Do you have any periods in the day where you feel close to normal or 100% normal? Because often patients, when they come in, they want to show their worst to the doctor. I actually want to see and hear their best times. And the reason for that is if the patient says yes to that, that means that there's reversibility to their process. That's it. That's the takeaway point. So if you have periods in your day when you feel better, when you feel good, when you feel 100%, that means there's reversibility to your process, and you can get to that point permanently.
So what are some common issues that you see in people that present with seizures? Do you see Bartonella or other microbial factors involved in a patient that's presenting with a seizure disorder?
Mm-hmm. So actually, majority of the patients who come to see me have more than just one infection. I'm going to say that all of the patients that I see have more than one infection. So anywhere from 2 to 5 infections, occasionally more than that. And so it's a combination. And I do have patients who have intractable seizures, and that's their presenting and kind of number one complaint, that we were able to subside their underlying epilepsy, severe generalized seizures that are very debilitating. and have been able to come down on their anti-seizure medications by treating their underlying infectious process. So that certainly does occur, but I do think that they need a thorough neurologic workup to make sure that there's no underlying structural problem that's actually causing the seizures as well. So it would be irresponsible to think that all seizures can be treated with some antibiotic, and certainly these patients also require anti-seizure medications.
It seems to me that a fairly high percentage of people that are dealing with Lyme and co-infections have tinnitus or tinnitus, have some ringing sensation in the ears. Do you view that as more of a neurological issue than an issue with the actual structure and function of the ear itself? And then have you seen anything that helps people that are dealing with tinnitus?
So tinnitus is not a localizing finding, meaning, it is a structure, it is a problem with either the ear or the nerve. So to answer to your question, we actually started with this, where I think that Lyme can cause basically cranial neuritis, and cranial nerve 8 is part of that. So it certainly is possible that Lyme disease can cause tinnitus as part of a cranial neuritis presentation, just like Bell's palsy is. And again, I have a handful of patients, actually they all happen to be men, whose number one presentation is this tinnitus and hearing loss, basically Meniere's disease. And with treatment of the infectious process, their symptoms have significantly improved.
Wow, that's
and
great.
They've actually regained hearing. I actually have about 4 to 5 patients in my practice who, aside from their other presentations, also had hearing loss and have to the point where they required hearing aids. And with treatment of their infections, they're no longer require any hearing aids, and their hearing has come back.
Wow, that's fantastic. You mentioned POTS earlier. We know that POTS is an autonomic nervous system dysfunction. I've heard some people associate that with Bartonella. I've heard others talk about adrenal issues. What do you think of when people present with POTS?
What I think of POTS is autonomic nervous system dysfunction. I don't differentiate it specifically to Bartonella or Babesia or Lyme. I often see that in patients who have Bartonella, but I actually have to tell you that I often see Bartonella in very debilitating neurologic presentations. So either it's psychiatric or physical symptoms that they have, a lot of pain syndromes, I will see Bartonella on top of Lyme as well. So I certainly think of it as a very neurotoxic bacteria that needs to be addressed. And the reason why I say that I don't really differentiate is because, in my opinion, you cannot just treat Bartonella, and then you cannot just treat Lyme. You have to identify all of these infections and treat them all at the same time. Otherwise, you're not treating any one of them effectively.
Very good. So in today's world, we see so many people that have mental and emotional struggles and illnesses and things of that nature. I'm wondering, do you think that a lot of these mental, emotional issues that we see in the world today may be related to infectious or microbial factors and an actual underlying physical cause rather than just being mental, emotional conditions?
I absolutely believe that. I think that in the next maybe 20 to 50 years, we will probably have an organic or an underlying cause for most of the psychiatric illnesses. And honestly, there are some papers that are coming out talking about the fact that 30 to 50% of patients who have an in-hospital psychiatric admission most likely have autoimmune encephalitis. And these papers are coming out of psychiatry and neurology, so I think the medical community is starting to explore this possibility as well. And you also have to think that, the history of medicine, always has been, when you don't know something, you basically call it psychiatric. I mean, we called gastric ulcers psychiatric before we found out that H. pylori bacteria is causing them, and many other conditions like that. So I absolutely agree, and I think that the world of psychiatry is certainly going to change a lot, especially with the exploration of this autoimmune encephalitis issue. And as you saw, there's a movie that came out in 2016, Brain on Fire, where she clearly demarcates how she was suspected to be psychiatric until one doctor, thought otherwise. So I think it is changing, and it's going into that direction.
I absolutely agree. I love so many of your comments because I certainly resonate. I remember years ago in a conference with Dr. Dietrich Klinghardt, and he said something to the effect of, when someone has mental, emotional issues, I think to look for their infections. And when someone has a knee pain, I think to look for their mental, emotional issues. That it's kind of the opposite of what you actually think. So one of the things that I see in people with Lyme as we're wrapping up here is a lot of stressed nervous systems. There's a lot of fear. There's a lot of anxiety. There's people that are just really struggling to kind of get through the condition. I'm wondering what you suggest for people that have those mental, emotional challenges to support them as they're dealing with these underlying triggers so that their nervous system can be a little more calm. How much of this whole anxiety, fear, depression is neurotransmitter based, and then how do you explore that issue?
Well, first of all, I think it's very important to have a good support system. And I think for a lot of patients, just validating the fact that they're not crazy and it's not just a psychiatric problem really gives them a sense of empowerment that they can fix this. They are willing. I mean, you've dealt with people with Lyme disease, and certainly I have. I mean, I think that some of these patients are so desperate. If I told them you have to go to the moon and eat a moon rock, they're ready to do it.
Yeah, I did that.
It's exactly. And it's so devastating to me as a physician and very emotional that, these people are ready to go to these lengths to get their life back. And I really think that the medical community, you can't ignore this anymore. And I talk about how I think it's a human rights issue because, so many people are struggling, so many children are struggling and can't communicate what's wrong with them. So really educating yourself and potentially finding the right physician and knowing that, I also talk about this on my social media. I sometimes feel that we're all one tick bite away from a psychiatric diagnosis.
Wow.
So, so you need to educate yourself. And a lot of people who are struggling, I also feel like, giving some power back to them when if you are feeling better and if you are cured and you are getting your life back, go back to these physicians who called you crazy or who called you that, you just need a vacation. Tell them about your story so that you could save the next person. And not everyone's going to be receptive to that. I get it. But even if you touch a few healthcare providers, then you're saving the next guy.
Absolutely.
So that's my advice. Keep pushing.
Tell us a little bit about your kids wear line that you came out with recently.
Oh yes, absolutely. So I'm a mom of two boys, 8 and 3, and my 3-year-old actually never touched grass. Because I got into this field about 6 years ago, and I was really scared, and I didn't know how to incorporate nature into our life, which is so important from the standpoint of what we touched on, meditation and feeling kind of getting out of the stress of a day-to-day life. Being part of nature is very calming. And so how do you incorporate that in? So my family and I created this Dr. Frid kids wear, which is mesh clothing because it's light and breathable, and you can wear it on top of your bathing suit or your shorts and t-shirt. and basically be safe outdoors, and doing regular activities like going to the playground or gardening outside. I mean, 90% of tick bites occur in our own backyard. So these are the type of activities that people should be thinking about, where you should be protecting yourself. And the clothing is actually treated with insect shield repellent using insect shield technology, the same thing that actually has been mandated by the U.S. military since 2009 to all of their clothing, because the U.S. military knows that insects carry diseases, and it is one of the things that their army personnel should be protected from. And that's something that mainstream, people should know about as well, knowing that the same way you protect yourself against sunburns, you should be protecting yourself against insect bites that may potentially be carrying debilitating diseases that one can have for years to come.
I'd like to hear a little bit about what you do for your own health. It's really obvious that your own brain is working really, really well. So can you tell us about some of the things that you do on a daily basis?
Oh, so I just recently watched What the Health, a Netflix movie. So I told you before that I always thought, diet is important, but kind of eating in moderation and trying to eat healthy, organic. But after watching that movie, I'm trying the fruit and vegetable diet. I'm feeling pretty good. Pretty good on it. I haven't lost any weight. Not that I was, using it to lose weight. I was just talking about it today, but I'm doing well with that. But really, what I do is I try to face my fears every day. So if something scares me, I go ahead and try to do it the best I can and try to excel at it.
That's fantastic. So can you tell us a little bit about where people can find you on your website and on social media? Where can we learn more?
Yeah, so my website is elenafridmd.com. The website for the clothing line was drfrid.com, drfrid.com. And on social media, it's Elena Frid on Instagram, Twitter, Facebook. I do that for fun at this point, and mainly really to raise awareness, because I think that people need to have a good source of information. There's a lot of stuff out there, and I think that's a very useful tool to kind of be able to communicate some ideas and thoughts with people. And sometimes I answer questions. I usually don't answer specific health questions, but I can guide people as to what they should do. So that's how I use my social media.
Fantastic. I feel like I need to take your social media classes and could learn a few things from you. So this has been absolutely fantastic. I appreciate you spending time with us today. I'm happy to have a practitioner that's in the realm of neurology that really believes that Lyme and co-infections can have a significant impact on people. It's good for people to hear someone that can validate that their struggle is real. So thank you for being here. I appreciate it, and I hope to see you at ILADS later this year. Thanks so much.
I will be there. So thank you so much, Scott. It was really great. I had a good time, and I hope that you guys find it helpful.
To learn more about today's guest, visit elenafridmd.com. That's elenafridmd.com. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.